I'm Dr. Shailesh Raina and I'm the Director of Urology and Renal Transplantation at the Jaslok Hospital, Mumbai. Urology per se has developed by leaps and bounds. And what is now newer aspects or newer subspecialties developing are basically robotic urology, which is basically an extension of laparoscopic urology, which developed more than a decade ago. Neurourology and incontinence, which takes urology to a different level altogether. Mostly people with spinal injuries, people with affections of the spine and nervous affections who have incontinence of urine, urge, and female urology which deals with urge and stress incontinence of urine. And then, of course, renal transplantation. Renal transplantation today, regarding cadaveric, renal transplantation has been going on in this country for the last 30 years. But cadaveric transplantation, which means taking kidneys from brain death patients, is about more than a decade old. And this is where we have to lay stress on so that people donate their organs. That's where we're lacking a little bit in this part of the world. But I'm sure that will pick up. Well, in India, globally, urology has made a lot of advancements. One in the field of andrology, with prostatic surgery coming in, penile prostatic surgery coming in the field of urology and incontinence with sphincters coming in, artificial sphincters coming in, and an understanding of the bladder function getting better with urodynamics and video urodynamics. In the way of operative urology, laparoscopy and now robotic surgery has come in a long way and a good way in this part of the world, with fewer cuts being taken, fewer long incisions being taken, surgery done in a more finer manner, and patient recovery time. Patients go home much faster. As far as transplants are concerned, more than operative skills, immunosuppression has come a long way, and our nephrologist colleagues have helped us such a great extent that today transplant is the favored choice for patients of chronic renal disease and not dialysis. There have been other advancements in urology which will again be gadget oriented, but robotics, neurourology, pelvic floor dysfunction, female urology, and renal transplantation and laparoscopic urology, all in a nutshell, is really the advancement in urology. Pediatric urology, a subspecialty of urology, is something which we'll have to develop much further in this country, but abroad it has come a long way. At the moment, the technique of renal transplants is standardized. The operative steps of renal transplant is standardized. Robotic renal transplants has come into being. I'm not saying it's the most widely accepted way of doing renal transplants, but it has now being developed and is getting further developed, robotic renal transplants. What is definitely developed in renal transplant is the donor nephrectomy, which means you have to remove a kidney from someone to put a kidney in the recipient. Now, the person giving the kidney is a healthy individual in a live-related transplant. So, donor nephrectomies are now done laparoscopically and even robotically. With that, there's hardly any scar and the patient has a much faster recovery rate. The success of transplants, renal transplants in this country is phenomenal. And in the institute I work in is absolutely phenomenal. But that is, forget the operative skills of the surgeons that we have, it's also a lot to do with immunosuppression and new drugs that we have for immunosuppression. And nephrology as a nephrology, that means the transplant physicians as a speciality, has come a very long way in this country. And that has helped the success of renal transplants. people are not still very happy or to give their kidneys. So now we have, the government has even made rules that even wives can give as relatives, because here in this country we still do only life-related renal transplants. So we have even wives as relations who can give kidneys, and we need more donors, and so we need the more public awareness of organ donation. Once we have that in full scale, then our transplant figures are going to go up even more. Pediatric surgery was mostly done by pediatric surgeons. Now, as far as pediatric urologists, we do not have a large number of pediatric urologists practicing just pediatric urology. So once we have more numbers of pediatric urologists in the country as a specialty, we'll have far better treatment for little children suffering from renal diseases. We have pediatric urologists, but in India as a whole, there are not very many pediatric urologists. That is a specialty of urology which has to be looked into, and we need more and more people going in for pediatric urology and practicing pure pediatric urology. I'm very, very fortunate. In fact, I think I'm blessed to be the director of a unit which actually started this whole thing of urology in a private sector. And many of my senior colleagues, many of my teachers have been from here. And we were the first to start in a private sector, renal transplants. And we have the maximum number of transplants in most private sector hospitals. Endourology, which is endoscopic urology, which means prostate surgery, stone surgery, lithotripsy, laser surgery. We've had this from 1980. I mean, lower tract endourology, we had this from 1978, 79. And upper tract endourology, for stone disease, we've been doing here since 1988, 89. So we were really one of the pioneers to upper tract stone disease endourology. Laparoscopic urology has also been started, is being done here. And now we have robotics also here. And there is no doubt that robotic surgery is here to stay. The cost sometimes is a bit prohibitive, but we do it for those patients who can afford it. So yes, we have a full transplant setup here, we have endourology sets up here, we have, for somebody practicing urology, what he can do here in our department is as good as what people do in the rest of the world. So we can't, we may not be as, I'm not trying to praise ourselves, our worthy colleagues, who are very worthy colleagues I have, but equipment-wise, we lack nothing.